So let's get right into the donut hole. Whether you're on Medicare yet or not, you've probably heard people talk about the donut hole. And the donut hole is actually the slang term. The actual term is called the coverage gap. And it affects people who are on high dollar prescriptions. That's basically who it affects. You know, I have a lot of people coming to the office, or I go see them, and they're like, I take a lot of prescriptions. I hope I'm not going to get into that donut hole. So a lot of people are fortunate enough where they're able to take generic medications. Those people typically are not affected. It's the people who have to get on these high dollar name brand medications that those are the ones that are very likely going to get into the donut hole. So let me give you an example. Drugs like Eliquis, Xarelto, things like that people have to get on for atrial fib. Those are high dollar medicines. So this is how it typically works. You just get on Medicare. Let's say you either took a Medicare supplement plan, you've got a standalone prescription plan with that Medicare supplement, or you've got a Medicare Advantage plan. It's got prescriptions built in. You go to the pharmacy that first month and you say, I need to get my Eliquis filled. They give you your Eliquis and they said that'll be a $47 copay. You pay the $47 and you're good. You may think, well, $47 is a lot of money, but if you know how much Eliquis cost, you're like, I'm more than happy to pay that $47. You go in the next month, same thing, no problem. And this can very likely happen for the first 3 or 4 or 5 months, but then one day you go into the pharmacy. You say, I'm here to get my Eliquis filled. The doctor gives you the Eliquis, or the pharmacist gives you the Eliquis, and they say, that'll be $125. And you're like, what? Why am I paying $125? What's happened is pretty much you've gotten into the coverage gap or the donut hole. And here's what happens. The $47 is fine, but behind the scenes, what you're not seeing is Eliquis. Let's just say is $500. Well, each month the $500, and then the next month another $500. When that reaches, and I'm going to give you the exact numbers here in 2021, when that number hits $4,130, so if you do the math, $500 for the cost of some of these medicines, in about 8 months' time, you're going to be getting into the donut hole. What happens at that point, instead of paying the $47 copay, now you've got to start paying 25% of the price of that medication. 25% of $500, what's that? $150? No, $125. So that's what happens. And I don't really have a great answer for people, but that's what happens sometimes. Yes, it pays to get on generics, but just quite frankly, there are supposed to be generics for every type of medication. But sometimes, quite frankly, they're just not as effective. Eliquis, to a lot of people, that is just like, it just really is able to control their situation. So anyway, that's the donut hole. There is this thing called catastrophic coverage. Once you've gone so far into the donut hole, you can come out of the donut hole and go into what's called catastrophic coverage. At that point, you only have to pay 5% of the price of the drug. But it's kind of like you got to go over this big hill before you get to the finish line. And sometimes by that time, the year starts over again. So hope that helps. Down below all these videos I've just created is my Medicare Made Simple course. If you want to get more detail on your specific situation, or if you have any questions, you want to give me a call, that's what I'm here for. Would love to talk to you. God bless. Take care.